Hello, Aaron. Hello, Aaron. Can you hear
Hi,
me?
sorry, I was muted. Hi, Dr. Newton.
That's all right. That's right. Um, yeah, so I think all the slides look great when we went through them. Um, I'd like to stop in the middle to see if see if people have questions.
Okay,
Maybe just take like maybe two or three questions, break it
sure.
up a little bit, and then finish the second half.
Okay, just
Um,
let me know. And we're live with some audience members now, and I'm about to go Facebook Live in just a minute.
okay, great. There's a slide that says, time for questions or time for pain relief. There's like a little slide there,
Great.
kind of in the middle. Now, can you see me okay?
Not yet. I think your camera. I don't know if your camera is on.
Let's see.
Let's see.
Start video.
There we go. I see you now.
Okay, perfect.
Alrighty.
You have some slides, some Trulieve slides that's going to be presented in the beginning.
Yep, we just had them.
Okay, well, perfect.
All right. Good afternoon, everyone. We're getting set up for Facebook Live as I speak. Um, you could probably tell. um, and then we're going to have Dr. Newton share some information with us about medical cannabis. But before that, I want to introduce him a little bit. If you all aren't familiar with me, my name is Erin Stagletter. I'm the education manager for the Virginia Breast Cancer Foundation. Uh, and we're going to be hearing from Dr. Newton today for more in-depth information on the effect of medical cannabis and breast cancer symptoms and other systems throughout the body. Dr. Newton is a board certified anesthesiologist, regenerative medicine consultant, and medical cannabis and pain specialist. He began his work with medical cannabis recommendations in Vermont back in 2011 and has been based in Florida since 2015. He specializes in trauma and injury patient evaluations, uncovering misdiagnoses, pre anesthetic, pre surgical evaluations, and advanced techniques in interventional pain management. Dr. Newton, if you caught that earlier, we're going to be taking some questions in the middle, but also at the end. So if you have any questions that come up for you throughout the presentation, please enter them in the chat and we'll get to them either at the middle or at the end of the presentation. So with that, Dr. Newton, you may begin whenever you're ready.
Okay, perfect. Great. So let me get my slides share here. Everything pulled up here. Great introduction. Really appreciate that. Very thorough. So let's see if we can get here and share my screen, and we'll get started. All right. All right. Can you see everything okay here?
Yes, thank you.
Perfect. Perfect. All right. So, I would like to start with just saying thank you for allowing me this opportunity to help educate patients. And we have attendees from Virginia. Actually, in North Carolina, there'll be a few people attending it, and also here in Florida. And so I appreciate this opportunity. I did want to mention that, I am trained to give medical cannabis evaluations. Also have a certification to be a director for medical cannabis dispensaries. Here in Florida, we can't currently do both, but maybe at some point in the future. I have done some research studies with one university that I'll be talking about a little bit later in the presentation. And I do different topics. So I speak on anesthesia, cannabis, interventional pain management, and other medical treatments for patients. So you had already mentioned some of my training and experience. My core training is in anesthesiology. I'm also trained to do interventional procedures. That's things like epidural injections, facet injections, spinal cord stimulators, pain pumps. I have a certification for treating opioid dependence. I'm a medical director of facilities here in Florida, but also North Carolina. And I'm a medical cannabis educator. Also do dispensary tours. My office staff here in Florida has also been on some dispensary tours as well. And I focus on educating physicians, patients, or anyone who's an advocate for patient options. So my learning agenda for everyone today is to start with talking about the endocannabinoid system. This is the most recently discovered organ system of the body. And I'm going to go through the different types of cannabis plants, and I'm going to define medical cannabis and talk about how it works, and we'll review some medical cannabis research. And at the end, we'll talk about the mindset of cancer prevention, so everyone has a more systematic approach to how they can think about it. So with the organ systems in the body, we have something called homeostasis, and homeostasis is maintaining a steady state. And we see this where our endocrine system communicates with other systems, such as the cardiovascular system, the respiratory system, and digestive system. And they all work together to allow us to maintain our health in a steady state, which is homeostasis. The endocannabinoid system, which is our body's own cannabis, includes parts of our central nervous system and our immune system primarily, but also our gastrointestinal system, metabolism, and hormones. And here we can see a physical representation of the endocannabinoid system, which consists of CB1 receptors here in the brain and CB1 and CB2 receptors here in the GI tract, where we have 80% of our immune system. This diagram here on the left zooms in on where one nerve cell communicates with another, and that's via this cannabinoid receptor. And so our body's own cannabis stimulates this receptor. The neurotransmitters are called anandamide and 2-acylglycerol, and this is the same area where medical cannabis works. So when we talk about THC and CBD, CBN, the different cannabinoids work on the same receptors that's already in our bodies. So when we think about cannabis and cannabinoids, there's different sources of where cannabis can come from. So we can talk about endocannabinoid, meaning in the body. We can talk about phytocannabinoids, which is cannabis from plants. We can also talk about synthetic cannabinoids, which is made in a lab. So when we talk about traditional cannabis therapeutics, things like Marinol is just pure delta-9 THC. All of these things, all these cannabinoids stimulates the endocannabinoid receptor. I have on the next slide a picture of Marinol. So here we have Marinol at the top right. We look here on the left, this is the actual cannabis plant. So these are the phytocannabinoids. Back in the early 1900s, physicians could prescribe cannabis here in the United States. And this is an example of that, of a cannabis extract. So this is an extract that's even, the process is very similar to how some of the medicine is prepared today, where there's an ethanol extraction. So basically, the plant is mixed with a solution that extracts the medicine out of the plant. And then you have the raw plant material that's basically filtered out. So then you're left with the cannabis oil. This here in the middle is Epidiolex. This is the first FDA approved medicine in the United States. This is FDA approved for seizures. And here on the right, we have cannabis tincture. This is a 1-to-1. This is actually one of Trulieve's products, where it has equal parts THC and CBD. And then here on the right, these are synthetic cannabinoids, Marinol and Sesamit, which is a THC analog. So here is Marinol. You see it's prescribed to many patients that are dealing with nausea and loss of appetite associated with cancer chemotherapy. You can see here it comes in at 2.5, a 5, and a 10 milligram divisions. And then on the right, we see Sesamit, which is a THC analog. I want you to keep in mind, when I say THC and delta-9 THC, I'm talking about the same entity, the same chemical structure. So now let's move on to see, as far as cannabis plants, what are the different types of cannabis plants and how do we actually get the medicine out of the plant? So you can classify cannabis plants in terms of their physical appearance or the amount of THC content. So with regard to the physical appearance, we have Cannabis sativa, which these plants tend to be tall in stature and have narrow leaves. And then we have Cannabis indica, which tends to be shorter in stature and has broad leaves. Now, when you just look at the plant and its structure, you can't tell by looking at it how much THC and CBD is actually in the plant. So you could have a sativa strain that has absolutely no THC in it. You could have another sativa plant that has a high level of THC in it. So when we talk about sativa and indica, we're just talking about the physical structure and not necessarily the components or the amount of cannabinoids that's in the plant. The majority of medications that patients consume today tend to be indicas and hybrids, and the hybrid is a blend of the sativa and the indica bred together to have basically the benefits of both plants. Another way that we often categorize cannabis plants is by the THC content. When we look at hemp, hemp has only trace amounts of THC, less than 0.3%, and hemp is available in all 50 states. When we look at marijuana, that's going to have, in some cases, as far as the presentation, I'll be synonymously using that with medical cannabis. But with marijuana, we have higher amounts of THC content, and the legalization of this varies by states. And I'll go a little bit more in depth into that in a moment. One thing I want to point out is that, with Virginia, they have the oil is available. Now, when the oil is extracted from the seeds, that's called hemp seed oil. That's very different from oil that's extracted from the flowering plant. So once the plant flowers, then you have CBD and THC. And here is an example of that. So hemp seed oil is rich in various omega acids, but it has no THC, has no CBD content because the plant has not yet reached the flowering stages. So this is when the oil is extracted here. Hemp oil can contain CBD because hemp oil is extracted at this point where the plant has made what's called the trichomes, and you have the flower that has the THC and CBD. So when we talk about medical cannabis, we're talking about the cannabis species plants. So that could be cannabis sativa, cannabis indica, or hybrid blends of those plants. The extracts are various preparations. It could be in the form of an oil capsule or topical, depending on what's available in your particular state, used to treat, prevent, or slow the progression of a disease or its symptoms. So this is the Virginia code for cannabis oil. And I wanted to focus here where they talk about dilutions of the resin of the cannabis plant that contains at least 5 milligrams of cannabidiol or tetrahydrocannabinolic acid, THCA, and no more than 10 milligrams of delta-9 tetrahydrocannabinol. This is basically THC per dose, okay? Which is very similar to most states where they go, the maximum dose is based off of 10 milligrams. So you may have a dose that's 5 milligrams or 10 milligrams. This is very similar to most states. The thing that seems to be very good about Virginia's program is down here, is that when they talk about symptoms to, we're going to alleviate the symptoms of any diagnosed condition or disease determined by the practitioner to benefit from such use. So that's very similar to what we had there in Vermont, to where the provider can decide on any condition that might benefit the patient. Here in Florida, we have a specific list of conditions. So with the Virginia cannabis oil, at least 5 milligrams of CBD or THCA, which I'll go a little bit more into that in a second, and a maximum of 10 milligrams of THC per dose. So when we talk about THC and CBD, what is the difference? So these both come from the cannabis plant. CBD is cannabidiol. It's not psychoactive, meaning it doesn't cause like a euphoria or any type of sedation. It's neuroprotective, where it can reduce inflammation in the brain, anticonvulsant, where it can help with seizures, antioxidant, antipsychotic, and anti-inflammatory. And you can see the structure here of CBD and THC is very similar because they're in the same category of medicines. THC is psychoactive. It's a relaxant, an appetite stimulant. It does cause some drowsiness, which is good for when patients are dealing with pain at night. It's an analgesic. It causes euphoria, which is good for patients dealing with depression and end-stage life issues. But it can cause paranoia and anxiety as a side effect. So that's where in a lot of cases you want to balance out where the patient has CBD and THC because the CBD can help avoid some of these side effects. So when we look at cannabinoids, this is the mother of all cannabinoids here, CBG. And CBG can be converted to THCA. And when that gets heated, it undergoes a process called decarboxylation and conversion to THC. If THC gets left out over time, it can actually, much of it can be converted to CBN. So if you have cannabis that's been sitting out on the shelf for a long period of time, this THC can convert to CBN, and you may notice it makes you feel a little bit more sleepy than if you take it after it's extracted. And this process can happen due to aging or heating. The THC can be converted to CBN. Cannabigerolic acid can also be converted to CBDA and CBD. And so we can see that the starting compound for both THCA and THC and CBD is the same. And that's why the structures are the same. In addition to cannabinoids, there's a whole other group of medicines that's in the cannabis plant called terpenes. And many of the terpenes are essential oils. For example, you might recognize this lanolol that's in a lavender plant and helps individuals to relax. You can also notice here alpha-pinene and beta-pinene. These are potent anti-inflammatories also found in pine trees. When low doses of many cannabinoids and terpenes are combined, they get a synergistic effect, meaning that very small amounts can produce high amounts of anti-inflammatory benefit, high amounts of appetite stimulation, and anti-emetic benefits. And that's because when we're combining these small amounts of molecules, they're all working in a similar fashion, but toward the same goal for the patient. And this effect is called the entourage effect. And so when you get many low doses of various cannabinoids and terpenes, you can have a profound benefit for the patient, because it's like taking more than 10 or 15 medicines in one, but in low doses. So with cannabis, we hear about how it can help with nausea, pain, and PTSD, but how does it actually work for those conditions? For nausea and appetite, the THCA actually reduces activity in what's called a chemoreceptor trigger zone. This is in part of the brainstem area associated with nausea. It can also help reduce vertigo. There's some secondary mechanisms. One is by reducing inflammation in the GI tract. This is where you see a lot of benefit for Crohn's patients and ulcerative colitis patients as well, and also in patients that's dealing with cancer metastasis to the bowels. There's some secondary, more indirect benefits with nausea, and that's when patients are dealing with severe pain, they're often nauseous, or if they're dealing with stress and anxiety. By treating those two symptoms, you can also have an indirect benefit in nausea. Typical doses between 5 to 10 milligrams THC. For patients dealing with severe pain, in general, between 5 to 30 milligrams per dose does very well, and depending on their metabolism, they may need to dose as infrequently as twice a day, or they may need higher doses, especially if a patient has had experience with cannabis, they may have some tolerance. Most patients benefit from a 1-to-1, meaning equal parts of THC and CBD, but if there's some degree of tolerance where the patient has had exposure to cannabis for a long time, they may need higher THC ratios. So here we have the pain pathway, and cannabis is unique in that it interrupts the pain pathway in several different areas. In the peripheral area, it's an anti-inflammatory and also a muscle relaxant, and inhibits the propagation of the pain signal here in the peripheral neuron. This is called the dorsal root ganglion, and actually slows the pain signal in this area. Here is where the pain signal travels up the spinal cord, and it activates these, or what's called descending pathways. And this is how antidepressants also help with pain, is as the pain signal is coming up, these pathways here slow that transmission to some degree, and it helps in the brain as well. So one reason why it's important that we have cannabis as an option is because we have an opioid epidemic where there's increasing amounts of deaths related to opioid overdoses. Cannabis, and here we see marijuana, and I'm using it interchangeably. You see zero overdose deaths, and that's because there's no receptors in the brainstem for cannabis, so it can't suppress someone's breathing like opioids can. This is a interesting research study that looked at states that have passed cannabis laws and implemented them between 1999 and 2010. And what it showed was that after the first year, there's a 20% drop in opioid-related deaths in those states. And this includes 10 states. So prior to 1999, we had 3 states that had medical cannabis. It was California, Oregon, and Washington State. And during this time, we had 10 states that passed laws: Alaska, Colorado, Hawaii, Maine, Michigan, Montana, Nevada, New England, Rhode Island, and Vermont. And it showed that they maintained that 20 or more % reduction in opioid-related deaths. And even after into the 5th year, it dropped to even more than 30% drop from the baseline. So that's really tremendous. This is a study that I did with Geisinger University. We basically did a retrospective analysis, and we expanded the data from this study. And we looked at cannabis' ability to help patients wean off of other medications. So not only opioids, but also benzodiazepines, sedative hypnotics, muscle relaxants, and looked at different drug classes. And so we were focusing here on pain, anxiety, sleep, patients' quality of life, and PTSD symptoms. All right, I'm going to stop here for a moment and see if there's any questions. So we're about a little bit more than midway through the presentation. I thought I'd just give it a little break and kind of switch it up a little bit.
Well, Dr. Newton, this is great. I don't think we've had, I know I haven't had the opportunity to hear more of the detail as to how it actually affects the body. So this is really helpful to hear. I haven't seen any content questions come up on the chat
Okay.
yet.
Okay. Well, what I'll mention here is that, you know, I think this study is important, and you know that's because when you're dealing with, and let's talk about cancer patients for a moment, even beyond just looking at the opioid-related deaths, you know, you may have cancer patients that are dealing with severe pain and they're needing increasing doses of opiates. So you can add, you know, they can still take their pain medication, but you can add cannabis and actually help them lower the dose, reduce the side effects, reduce the constipation, reduce the nausea, and get even better analgesia, even better pain relief with lower doses of opiates by adding the cannabis. And so I think this study is something that's very nice to build upon. And with this data here, you know, that we looked at, you know, I think this can also be expanded for where you can focus in on the PTSD, you know, associated with the cancer diagnosis, or you can focus in on the pain associated with the cancer diagnosis. So this study can be built on even further. And it'd be great to see in the future where this data gets expanded upon, either if that's done here, you know, with Geisinger. In a moment, I have a study I wanted to present. It was actually the first study on the anti-neoplastic activity of cannabinoids, and that was actually out of Virginia Commonwealth and the Medical College of Virginia. It was a collaboration, which I'll show that in a moment.
Dr. Newton, we did actually have a question come in asking you if you could expand on the difference in impact on the pain receptors with regards to Neurontin versus cannabis for pain management.
Yeah. Okay. So one of the ways that Neurontin works is Neurontin, it reduces how nerves fire. And the other name for Neurontin is gabapentin. And gabapentin is important because a lot of cancer patients deal with neuropathy. They have chemo-induced related neuropathy. And neuropathy is like a pins and needles sensation. That's you know, that usually develops on the feet or on the hands. Where cannabis intersects with neuropathy is that, you know, there are, probably, 3 or 4 of the most difficult pain conditions to treat. One of them is neuropathy, and cannabis reduces the inflammation around the nerves. So gabapentin is going to interrupt the pain signal, but it's not going to actually reduce the inflammation. And so the advantage of cannabis is it actually can promote some of the healing process by reducing that inflammation on the peripheral nerves, but it also interrupt the pain signal as well. And so it doesn't work in the same area as far as the receptors as gabapentin, but as far as the analgesic efficacy, it tends to be much, much greater because it is actually promoting some of the healing by reducing the inflammation. All right, so let's go on to just quickly talk about anxiety and PTSD. And this is very important. And here, the cannabinoid receptors in the amygdala that's associated with stress, fear, and pain are being activated and modulated. So we have activation of those CB1 receptors is going to reduce the acetylcholine, which provides a short-term memory reduction. So that's what we want. When somebody is remembering a traumatic event, that's where we want to take advantage of the reduction in short-term memory. We often hear about cannabis, a side effect of cannabis being, memory if you take too much of it. So this is good where we're using that effect to our advantage. You can also see a paradoxical effect with sativa strains, where sativa tends to be a stimulant, but for some patients dealing with ADHD and PTSD, it actually has a paradoxical effect similar to how Adderall works. For a cannabis naive patient, you want to focus on that just means that naive just means they haven't been exposed to cannabis before. You want to focus on the high CBD because that's going to protect them from the side effects of THC, but they still get some of the benefits of THC with it being present. It tends to work better than a 1-to-1. And these are some typical doses. So these doses are a goal. This is not where the patient starts, but they gradually work up to these doses. If they get the desired goal before they get to that dose, then they can just stop there and not continue to take more and more. For cannabis experienced patients, most patients will need a 1-to-1 or a high THC cannabis because they'll have some degree of tolerance. And they can also switch from one form of cannabis to another as well. So experienced, those patients, we're going to benefit. You see 50 to 100 milligram of THC. So there's emerging and evolving research that cannabis and cannabinoids can inhibit some types of cancers from growing. And they do this by activating our CB1 and CB2 receptors on our leukocytes, which are a type of white blood cell. They induce something called apoptosis, which is a programmed cell death. THC can also induce a protein called ceramide. Ceramide functions to help provide energy for the cell in a specific part of a cell called a mitochondria. That's often called the powerhouse of the cell. If everybody thinks back to biology and chemistry, we talk about what's called the organelles, the different functions of the cells. And the mitochondria is where the cell is going to get its energy and its ATP from. CBD can also inhibit some types of cancers. One specific gene is the ID1 gene. And that ID1 gene, that's the inhibitor of DNA binding, that's found in over 20 types of cancers, including nasopharyngeal cancers, thyroid cancers, ovarian, prostate, and colon cancers. So with THC and CBD, the next thing I want to focus is just show one study looking at THC, one study looking at CBD, and a third study that combines various cannabinoids. So this is the first study, this is actually conducted in 1975, that looked at the anti-neoplastic activity of cannabinoids. This study came out of Virginia Commonwealth and Medical College of Virginia. And what they found was that Lewis lung adenocarcinoma growth was retarded. So this was reduced by oral administration of delta-9 tetrahydrocannabinol, which is THC, delta-8 tetrahydrocannabinol, and cannabinol. But in this particular study, they said that it was not inhibited by CBD. But what I want to focus on here is if we take a look at this diagram here on the left, and I want you to look here, increased lifespan. So this is showing that mice that were given THC had an increase in lifespan compared to the control group. Okay, so this is the control group that wasn't given anything, had a mean survival time of about 30 days. And here we have mice given increasing doses of THC at 50 milligram per kilogram, 100 milligram per kilogram, 200 and 400 milligram per kilogram. And we can see that survival, instead of 30 days, 37 days, 34 days, 38 days, 39 days. And then also, traditional chemotherapeutic agents also increase survival time as well. 40 days, 42 days. Okay, so here we have, cannabis showing as much of as a 27% increase in survival, and then traditional chemotherapeutic agents also showing an increase. And so it makes you wonder what would happen if we combine the therapies. Will we get an even larger life expand increase? The other study I want to focus in on looks at CBD. And this is cannabidiol induces programmed cell death in breast cancer cells by coordinating the crosstalk between apoptosis and autophagy. And so this is a graph here. So on the x-axis, we have CBD concentration. And on this axis, this is cancer cell survival, okay? So we want the cancer cells to not survive. So we want this to be low, right? So this is the starting point. And this showed that as you increase the CBD concentration, there is lower cancer cell survival, right? We don't want the cancer cells to survive. We want that to be as low as possible. And that is what's happening as you're increasing the CBD concentrations. And this is just a picture here showing apoptosis. This is a normal cell, and this is apoptosis, which the cell looks like Swiss cheese. These are something called vacuoles. Okay, so when we talk about autophagy, this is a natural regulated mechanism where the components of the cell are put in what's called vesicles, and then lysosomes break them down. So basically enzymes are breaking it down. With traditional chemo, you're lysing or breaking the cell, and all these cell contents are coming out and making it, in some cases, make the patient very sick. Because now you have everything that's in the cell, potassium, enzymes here. But when you have apoptosis, it's more of a programmed cellular death, and the patients do not get sick when this happens. Okay. And so the last study I just wanted to focus on, this is actually a review of other studies, future aspects of cannabinoids in breast cancer therapy. And what this shows is that there's multiple studies that have looked at different types of cells and different types of cancer in mice, and not just THC and THCA, but also CBD. So this shows many different mechanisms of how cannabinoids can interrupt cancer progression. So for some of our breast cancer patients, these are some typical doses where patients have responded in terms of their cancers. Now, I wouldn't recommend to take cannabis alone as a treatment for cancer, but these are some patients that have had very good benefits. So with the breast cancer, as well as with other cancers, we generally recommend consume THC and CBD because they work by different mechanisms. And so we have patients benefiting from as low as 15 milligrams of CBD to up to 250. And with the THC, as patients responding with as low as 30 milligrams of THC and up to 250 milligrams. And this is just not applicable because you don't see breast cancer in pediatric patients, but I do have a slide here just for comparison. And this is showing for glioblastomas and other types of brain tumors. Cannabis is very good for brain tumors because cannabidiol and THC, they're lipid soluble, so they get good penetration into the blood-brain barrier. And here we see that adults tend to require lower doses than pediatric patients. And this could be because with pediatric patients, they may have more aggressive tumors, but patients respond very well. And we do have some patients on maintenance doses of cannabinoids to prevent recurrence of tumors and cancer. And then for prostate cancer, see the dose is a little bit higher than what we see for breast cancer patients, but very similar. So, but at least 50 milligrams of a 1-to-1. So now that we looked at cannabis research, the last thing I want to focus on is the mindset of cancer prevention. So this is going to help you develop a strategy to prevent cancer from occurring in the first place, but also educate you on how to approach and how to maintain the overall health of your body with respect to preventing cancer. So we're going to start with a mind, body, spirit approach. And the reason we start with the mind is because we have to fill ourselves with the knowledge of cancer prevention and its treatment strategies. And then we got to move from the knowledge phase to the action. And the first physician, Hippocrates, he said, let thy food be thy medicine and let thy medicine be thy food. So you want to consume cancer preventing foods and plants. So that's things like cruciferous vegetables, broccoli, cauliflower, and Brussels sprouts, broccoli sprouts. And you want to avoid cancer causing behaviors and substances. And then we also want to focus on exercise because that's going to boost our immune system and our body's own cancer fighting mechanisms. In addition to the body, we then want to focus on the spirit, and we focus on that by strengthening our spirit through meditation and prayer. We want to schedule sessions of meditation and prayer so that can help us reduce our physical stress and our mental fatigue. So that way we're more prepared to learn more about these strategies that help and then implement those strategies. We'll have the energy to implement those strategies by filling our spirit and helping us reduce our mental and physical fatigue. So these are some of the steps that we, want to make sure that we're incorporating in our lives. Stress reduction and a healthy lifestyle can help promote our health, promote homeostasis, and a dysfunctional immune system promotes inflammation and loss of our protective mechanisms. We want to also see what we can do to avoid cancer by avoiding those causes, which we'll talk about in a moment. We can reduce the development, progression, and recurrence of cancers by, having a knowledge of the successful treatments. We want to establish a generalized cancer prevention program, and then we want to have one that's personalized for us individually. And the way we do that is by knowing our personal medical history and our risk factors and our family history. And we want to realize medicine is not an exact science. So what might work for someone may not necessarily work for us. So that's why we want to have strong team members. And so you want to have your OBGYN, your primary care doctor, and your family members, which are going to help you get your your family history. And the imaging center, your radiologists, as far as like the imaging studies, you want to make sure that they're on your team as well. And this may also include caregivers, friends, and other specialists, as the needs change over time. So we're going to start with the mind approach here. We're going to fill ourselves with some of the knowledge of cancer prevention and treatment strategies. So 1 in 8 women in the United States will develop cancer over her lifetime. There's over 250 new cases per year. Breast cancer can also occur in men. About 1% of breast cancers occur in men. The listeners might have heard of the story of Beyonce's father getting diagnosed with breast cancer a few years back. So we need to know what is breast cancer. This is a nice video. I'm not going to, for the sake of time, I'm not going to play it here, but this is something to look back into. But cancer is uncontrolled invasive cell growth and metastasis, and these are the stages. It starts with the mutation of a cell, hyperplasia, dysplasia. So these cells no longer represent the initial cell. When you have dysplasia, cancer in situ, so the cancer is growing at the site where it started. And then you have metastasis, where cancer is spreading from the site it was originally and spread into other sites through the bloodstream. So we're getting into talking about stage 4 cancer. So what is the most common screening test for breast cancer? So, of course, most common screening test is the mammogram. It's a specialized tool for helping to screen for a specific type of cancer, which is breast cancer. But from a holistic point of view, is there a way to actually prevent cancer from occurring in the first place? Okay, so a mammogram can help us find it and diagnose it early for treatment, but can we prevent it in the first place? So we'll answer that question in a second, but I just wanted to show quickly what your radiologist is looking for when they look at your mammograms. And so they're looking at the density of the breast tissue. So this is less than 25% dense. So this is a single lesion. This is more diffuse. And then we're getting into 50 to 75% density. And this is extreme density where you're at greater than 75% dense tissue. So the answer is yes. More than 40% of cancer cases can be prevented, and this is including all types of cancer. And we can avoid smoking, avoid obesity, avoid alcohol, avoid UV radiation and excessive sun exposure. We see that more so here in Florida than you probably see that there in Virginia. Avoid physical inactivity, because we had looked at earlier, we discussed how exercise can promote a healthy immune system, which is how our body fights cancer. And we want to look at poor diet, so not consuming cancer-fighting foods and substances. So where do you start? You can start here with the Virginia Breast Cancer Foundation and expanding your knowledge. You can also access the Prevent Cancer Foundation and the Cancer Prevention and Education Society. And I want to just encourage everyone to implement that mindset of breast cancer prevention by starting, number one, educating yourself. Number two, putting that education to work and taking care of your body. And then scheduling the meditation, the prayer to feed your spirit so that your mind and your body can be at its strongest. So in summary, we learned about the endocannabinoid system, which is the most recently discovered organ system of the body. We reviewed the types of cannabis and talked about hemp, which has low amounts of THC, and marijuana, which has higher amounts of THC. We also compared hemp seed oil, which has very high nutrient omega acids, but no CBD, no THC. And we looked at hemp oil, which can have high amounts of CBD. We learned that medical cannabis can take various forms, but ultimately it's the goal, and that's to treat a medical condition or symptom. That's the goal of medical cannabis. We looked at how it works for nausea, pain, anxiety, and PTSD, and cancer. And we also learned the mindset of cancer prevention. So I just want to end by saying thank you to the Breast Cancer Foundation. And I also want to thank Trulieve as well for kind of bringing things together. I want to thank my office staff for scheduling the time for me to do the presentation. I want to really thank all the attendees and supporters of breast cancer awareness.
Thank you so much, Dr. Newton. This was wonderful, very comprehensive, and we do have a few questions that have come up. So first, I want to ask, cannabis seems to have a reputation for lowering energy. Are there strains that can increase energy and or focus?
Yes. Let's go back here, zoom back to many of the sativa strains actually are good for energy. And, sativa strains tend to have traditionally, like now we have a lot of crossbreeding, but traditionally CBD was highest in sativa strains. And so we know that the sativa strains, with the high CBD that can protect, and it can protect the patient from the THC side effects of sedation, but also CBN, cannabinol, also causes some sedation. So there's several ways to avoid that. So you want to focus on sativa and also sativa dominant hybrid strains. And then you also want to look at those plants and those oils that are higher in CBD. So that will help prevent the sedation of the THC in the CBN. So that's a very good question.
Another question is, can medical cannabis be useful in the treatment of diabetic neuropathy?
Medical cannabis is useful for the treatment of any type of pain, and that's because it works on multiple areas in the pain pathway. Diabetic neuropathy is important because that's the number one cause of neuropathy overall. And there's multiple studies that have shown, it wasn't in the context of this presentation, but many of the initial studies on neuropathy and medical cannabis were actually done in diabetics. But the short answer is yes, absolutely. And it does extremely well.
Thank you. Another question is whether you have any thoughts about Delta 8 versus Delta 9 THC.
Okay, so let's go here to this pathway here. I will say a couple things. One is, when we look at cannabis research, we want to hopefully focus in on the benefits of the cannabinoids together. I think it's good to look at them individually too. But as far as where patients, consume cannabis because they're getting it in general from a cannabis plant, I think it's good to have multiple cannabinoids. So I wouldn't recommend to say only take Delta 8 or only take Delta 9, because if they're working together, and then specifically we see here, I mean, there's other benefits of Delta 8, but as far as, the purpose of this slide that was presented, you can see it has antiemetic properties. So combining Delta 8 and Delta 9 at low doses, may give patients a synergistic amount of benefit. So we can keep, just maybe, 2 to 3 milligrams of Delta 8, 2 to 3 milligrams of Delta 9, which this is Delta 9 THC. And that could give a patient benefit, reducing any side effects they might have had with the Delta 9 alone, such as what you just asked about a second ago, which is the sedation. So if they're dealing with sedation from Delta 9 THC, maybe add a little bit of Delta 8, and then they're getting the benefit to that. They don't have to take as high of a Delta 9. And so that's going to be shown in the lab analysis of your medicine and the cannabinoid breakdown. Some states, and we see here, as far as Virginia, they're reporting mainly the content of the THCA, the Delta 9 THC, and the CBD. So you might have some oils where you don't know what is the exact Delta 8 concentration because they don't necessarily have to report that.
Okay, thank you. Another question. This is more of a policy question. You might have some information on it, but how do you travel out of state with medical marijuana, or can you? If not, what are the other options to relieve pain while traveling?
Yeah, it's and I would say this is one of the biggest challenges about it not being, available as far as how we could in the early 1900s, where it was available nationwide, where we saw the cannabis, we saw here in the beginning, the cannabis extracts here. So this is a time in the early 1900s where this was available from a federal standpoint, so nationally. And, thankfully, we have states that are doing several things. One is some states will accept other states' cannabis cards. So if you're a legal patient in one state, they'll accept it as far as you having it. But you really have to look at each state individually. I mean, it's really unfortunate and sad. So for example, when I was in Vermont, in Vermont, you can grow cannabis when I was there. And if you cross the state line to New York, you get arrested for it. So it's like, it's fairly, from my standpoint, it's politics interfering with medicine. But it's just, something that we have to deal with and be advocates for that. So I actually had a patient. Well, this was I'm just sharing her experience. I'm not recommending that you do this or not, but she traveled out of state and did just fine. She didn't have an issue. But you have to look at each state, and you have to, I can't recommend that you go against a particular state's law. So like for patients that are traveling within your state, you generally don't see any problem. So let's say, you're flying from one part of your state to another. The good thing is that, the TSA does not, bother cannabis patients. I haven't had any patients have any issues as far as traveling, because they're not after, harassing patients, as far as the medical cannabis. But if you travel, just try to have your card with you. Have all the, documentation that's showing that you're a patient, a certified cannabis patient. But I can't recommend that you travel to a state without, adhering to their rules and regulations. but hopefully it will be a state to where they'll accept another, they'll step your state's cannabis card.
So another question we had was about nerve pain. I know you mentioned earlier that it's any kind of pain, but question about nerve pain for spinal cord, if this is helpful for that, and talk about how the cold can make the pain worse.
Yeah. So the advantage of the cannabis is that, and this is this diagram here. See if I can move this up here. This diagram here shows where antidepressants help with pain, stimulation of GABA receptor, opioid receptor, NMDA, and cannabinoid receptor. So now, as far as one nerve stimulating and activating another, whether you're taking opioid, whether you're taking gabapentin or ketamine, whether you're taking cannabinoids, that would all have some influence in reducing the transmission of the pain signal. So whether we're talking about pain from a spinal cord injury, we're talking about pain from muscle spasms or nerve damage, it will interrupt this pathway. And when using combination, whether it's a low dose opioid, low dose nerve pain medication, in some cases low dose antidepressant. The problem with antidepressants is there's a lot of side effects with those. You can see things like dry mouth. You can also see changes in blood pressure. So sometimes patients get dizzy with it, but hopefully by interrupting several areas of this pain pathway, including cannabis, patients will get benefit. I've never seen a patient that didn't get some benefit as far as for cannabis for pain. I'm not saying that that's all that they took, that every patient can come completely off of all other pain medications. Some can, many patients can, but a common experience is at least they'll be able to come down 25 to 50% in their pain medication, their opioid pain medication.
Thank you. I think we've got one more question at this point. Do you have advice for breast cancer patients on how to talk to their doctors about using medical cannabis?
I think number one is to be patient, because you have to realize that, this system that we just talked about here, this endocannabinoid system, this was not something that has been taught in medical schools, right? This was discovered in the, like 1990s, but then also you have many states that they just haven't had cannabis to be available. Back in, that study that we looked at, 1999 to 2010, at that point, we only had 13 states. We had, so you have to, number one, be patient with your doctor. Let me go back. We talked about, sorry, I'm skipping too much here. So at this point, this is 2010, we only had 13 states. And prior to 1999, we only had 3 states. So it's not something that is yet integrated into, the standard of education in the medical field. So what I would say to start with is bring one of these studies to your doctor. If you're interested in it, whether you're talking about, the cancer itself, or if you're talking about, the anxiety associated with it, if you're talking about, as a pain reliever. The good thing about Virginia is that they have the flexibility for any condition that the physician deems medically necessary. Ideally, it will be integrated with your, by your physician that's already treating you, that knows you best. But sometimes, when cannabis is relatively new to a state in the first few years, you have to go to a special physician that is going to focus on your, endocannabinoid system. And, you may have to have a second doctor to do that certification. And it's going to depend on your doctor's comfort level. But I would say start with bringing them a study, bringing them a research study, showing where cannabis has benefited some patients. That way you have some concrete evidence, because they can't argue with data. We're, as physicians, we're scientific, we're scientific minded. And we're focusing, on, okay, what's the data? Where's the evidence that shows that this helps and this doesn't? But if you come to a physician, I think on that level where you're showing some of the research studies, I think they're more likely to take it seriously.
So I wanted to point out, I've had some questions come in that are more Virginia specific. So I wanted to direct people to our website, www.vbcf.org, which has a page on medical marijuana. You can find that under the medical care and support menu. And then the name of the page is medical marijuana. We're going to be beefing that page up over the next few weeks and months as different dispensaries open up in the state. So that's a resource. And we also point to Virginia Normal as a resource as well here in Virginia when it comes to accessing medical cannabis. So that's where we recommend you take a look. We have another question. Is cannabis only an option for cancer treatment in addition to chemotherapy compared to as an alternative for patients who can't use chemo?
For Virginia, it's available for any condition that the provider deemed medically necessary. So if you have a specific condition like cancer, or even the condition is I can't tolerate chemotherapy, it's available. It's available for that.
I think also, as you mentioned earlier, you wouldn't recommend this as a replacement for
Correct.
Other prescribed treatments. So
correct. Yeah. So, that data I presented, these are patients that was their choice. That's they wanted to just do the cannabis and they had improvement. But the difficult thing is that there's more. There's hundreds of cancer genes, and we don't know will that particular cancer, will it respond to cannabis? When we think about, specifically breast cancer, about 20 to 25% are the HER2 new gene. And you have, 5 to 10% are BRCA1 or inherited breast cancers. And so those haven't been extensively studied. In most of these studies, these are, in vitro studies, or these are studies in mice. So we need to have more research to see, okay, as far as the actual human patient, what is optimal. And in general, patients do best when they have both the traditional treatments and cannabis combined. And the other thing is the cannabis can help a patient tolerate the chemo and tolerate the radiation, because it may deal with pain and nausea and a variety of symptoms. And you can even have where a patient has successfully finished treatment, but now they have lingering anxiety, they have PTSD, they have pain either from mastectomy. It's called post-mastectomy pain syndrome. And so the cannabis is something that could be continued in terms of treating the other symptoms as they may be ongoing, even after the cancer has resolved.
And, just talking about the traditional medicines that we use in cancer treatment have extensive research behind them and why they work and how they work. Unfortunately, because of how marijuana is classified currently in the federal government, we just haven't had the opportunity to have all that research. So it's absolutely better to stick with what we know works and know how it works more so for primary treatment. But it sounds like that there's a possibility if we can get some more research done about adding.
Tremendous it's been tremendous over time. The survival rates of breast cancer have been, the highest that they've ever been. And that's because, like you mentioned, the research and showing what therapies are going to help with which cancers. And the important thing is, what is the type? Is it a hereditary breast cancer? Do you have a 90% chance of getting it? Is it something that responds? 8 out of 10 or 9 out of 10 patients will respond to this particular treatment based off of the DNA. So based off of the HER2 new, the BRCA, or whatever gene that is, the survival has been great. And that's because of organizations like yours that support breast cancer research, breast cancer awareness, breast cancer testing. And so definitely, focus on, with your OBGYN, with your primary care doctor, to get the standard therapy, at least get the standard of care. If you want to add cannabis on top of that, that's a plus, but at least get the standard of care for your diagnosis.
Well, Dr. Newton, we are at time, it looks like, and we also don't have any more questions coming through. So again, I wanted to thank you for your time. We really appreciate it. We're going to have this recording available on our website sometime over the next couple of days. So if you missed any portion of it or want to share it with folks later, there'll be the video will be available on our website, so you'll be able to do that. So thank you to Dr. Newton, thank you to Trulieve, thank you to our audience for attending. We really appreciate it.
Yes, thank you. Appreciate you.